Welcome back to HealthWise. And if you're just joining us tonight, my special guest is Dr. Albert Gros, and our topic is expanding pain management options here in Opelousas. Dr. Gros, tell us a little bit about the pain clinic and that concept, and also the origins and development.
The pain clinic is currently located at the Opelousas General Health System South Campus, right off of I-49. And it got there by some long tract. The origins of the pain clinic as part of our anesthesia practice here in Opelousas for the last 18 years. We've had a pretty active pain component to the practice. And in recent years, there's been somewhat of a need identified by Dr. Weibel and myself to help our local people in Opelousas to basically provide a service that they wouldn't have to travel to Lafayette or Baton Rouge or Alexandria for more advanced pain management. And so what happened was, in the last 2.5 years, Dr. Weibel and myself, as well as some help from some of my anesthesia partners, we developed a pain management clinic for this area. And the primary focus, unlike some pain management clinics, is more procedural based. We tend to see patients that are having ailments related to spinal stenosis, herniated discs in the neck, in the back, also with arthritic type pain in the back. So the spine is our primary focus. However, we do see some patients that are having ailments, pains that are in the arms, legs, that are related to spinal disease. More recently, Dr. Weibel and I put some time into expanding the scope of the practice from a procedural standpoint. And everybody talks a little bit about epidurals, which are common for basically epidural steroid injections.
Right. Now, basically, this is for chronic pain people, not just someone that has a pain that just occurs and it's just a minor thing. This is for people that have chronic pain every day, that they're constantly, dealing with on a day-to-day basis, that I guess not able to function.
Correct. This is not for the average guy goes out and overworks moving some furniture necessarily and has a little muscle soreness. We encourage our local physicians that are primary care providers to address these, because these are typically ailments that will get better with short course of time. Our practice is more based on, like you said, chronic pain. These are people who have some surgical, some non-surgical disease, and typically we're looking at people who have had pain for greater than 3 to 6 months. Our practice is a referral based only, so we tend to do a pretty good job of capturing that particular population.
Well, yeah, you said it's referral only, so one couldn't just walk into your clinic and say, okay, this is doc. They would have to have another physician refer them to you, correct?
Absolutely. We do have some patients that come in occasionally, and we will accommodate these people in attaining the appropriate information and seeking initial care and management by a primary care physician. Our role as an interventional pain clinic is to take people who have failed conservative medical treatment initially.
Okay. Well, you were talking about epidurals, but before we get that far in, I know a lot of people are used to, let's say, I guess to tell a lot of the pills are Lortab, Vicodin, those kind of things. Is that used sometimes in pain management?
Yes, it is. The medication side of it is an adjuvant. It's a part of it all. As part of our pain management, we tend to practice a multimodal approach. In doing so, there may be incorporation based on a patient's medical history, non-steroidal anti-inflammatories or Tylenol-based medications, narcotics. Sometimes we do use antidepressants, which also have some properties to subside some of the pain symptoms that the patients are having. Okay. So we do use oral medications as part of our multimodal approach, as well as some physical therapy referrals. We do manual therapy referrals, and occasionally we do surgical referrals.
Okay. All right. Well, I see here, you know, where it says that you do epidural. You know, you were talking about that. How would you determine whether someone needs an epidural versus just the, you know, oral tablet or whatever? How would you determine that?
Well, basically what we do is when you would come to the clinic by referral, we would evaluate the history and physical provided by the original physician, basically to get an idea of kind of what we're working with initially. To make sure that it's an appropriate consultation initially, we wouldn't want to waste the patient's time to come in and it either be outside the scope of what we practice or something that could be managed very easily within a primary care setting. And then at that point, we focus our time on the patient. We basically sit down, we have a person-to-person interview with the patient. We do an extensive physical exam. And then based on that, if the patient has MRI findings or CT findings, which are consistent with spinal stenosis, with lower back pain or neck pain, also with people who have pains that radiate into the legs related to stenosis, those patients are also candidates. And then in some subpopulations, people with arthritic type pains have shown to have some benefit as well from epidural steroids. And the epidural steroids are a great starting point. It's the least invasive, or we'd probably say the least meticulous of the procedures that we perform. And so it's a great starting point. If patients get relief from that, then there's no use to advance to a more
okay. So the epidural, when you do that, is it, I mean, side effects, are there any, or I mean, I know everything has some sort of side effects. But,
everything has side effects.
But I mean, is it the least, you know?
It is. It does have some side effects. The side effects from the epidural steroid are no different than the side effects of steroids in general taken by mouth. So if you are a diabetic or you are a hypertensive, meaning you have high blood pressure or high blood sugars, then these patients should have close contact with their primary care physicians, because the steroids can increase your blood sugars or your blood pressure. It can also cause restlessness, as well as some skin flushing. So we do have a lot of fair-skinned patients that call in later in the evening, say, I'm really starting to get a little redness around my neck or on my face, and that would be a normal side effect of the medication, nothing to be alarmed about.
Okay. Well, Doc, thanks again, and we'll be right back after this message from our sponsors.